Hello everyone, and welcome to our new Facebook Live. Thank you for joining us. Today the subject is about the diabetes disease. And for this, we welcome our Chief Medical Officer, Dr. Gerard Lallande. Hello.
Welcome. Bonjour.
Good morning. So maybe you can start with a brief introduction about the diabetes disease.
I think diabetes is a disease which many people, if not everyone, has already heard about it. It's a disease which is a result of an imperfect regulation of the glucose, which is the sugar in the blood. And the main issue is there is, as you may have heard, an insulin, which is an hormone produced by the pancreas, which will facilitate the sugar to enter in every cell. So diabetes will occur when there is not enough insulin to push the sugar into the cell. So the sugar will accumulate into the blood, and the accumulation of sugar in the blood is called diabetes. So there are different types of diabetes. Maybe we can discuss.
We all know that we have two types of diabetes.
That's correct.
Could you please explain what is the difference between them?
Yeah. So still the core problem is a lack of insulin. In the first type, which is type 1 diabetes, there is a total lack of insulin, which is based on the fact that the body will destroy the cell, which are called beta cell of the pancreas, to produce insulin. So this cell will be destroyed by some kind of autoimmune disease. So there will be almost zero secretion of insulin. And that happened in young subjects. So we call it also the young diabetic type of diabetes. Okay? So because of the fact that there is no more insulin, the only way to survive is to inject insulin into the body. Without insulin, these people will die. Simple as this. The second type is called maturity onset diabetes. It occurs in people who are mature, adults, usually around 45, 50 years old, and usually are people who have been often having an excess of weight. They are often diabetics, and they are often also inactive. Okay, so these are the results why the insulin will become still produced by the body, but in much lower quantity, and also because of lack of effectivity of insulin. There is still insulin, but the efficiency of the insulin hormone to push the sugar into the blood is reduced, and we call it, this mechanism is called insulin resistance. Okay? So for this type of type 2 diabetes, the treatment will be medication. And the main medication, objective of that is to either make the insulin more effective at the level of pushing the glucose and the sugar into the cell. So there are some type of medicine which reduce the insulin resistance. That's the first approach. Second approach is to still try to stimulate a bit more the insulin from the pancreatic cells, which are not destroyed, but they are not producing enough insulin for the person because of obesity, for instance. Okay. Now, two approaches. Now there are many new medicine which came into the market available for people. Sometimes, even though the person has type 2 diabetes, he may need also insulin because the severity of the increase in glucose will be high enough to justify insulin injection in that case. But most of the type 2 diabetic patients are treated by medication only. Okay. What we see, I'd like to add this, Alex, is the fact that in the past, we have a clear distinction between type 2 young people and type 1 young people with total deficit of insulin who needed insulin injection, and type 2 old people who just needed medication. But because of the kind of epidemics of obesity we have, and including Thailand, not only in the US. The US is huge, but also in Thailand nowadays. We see people with severe type 2 diabetic only at the age of 25 or 30 years old, which we didn't see before. which means that these people at the age of 35 or 40 will still need insulin. And that's a problem because they will need insulin for the rest of their life. Okay? Even though insulin now is better used, including a pump of insulin, so it's much easier to manage the condition. But the epidemics of obesity has almost induced a third type of diabetes problem, which is young people developing very early type 2 diabetes.
Okay, thank you for the clarification. So I have a question I am quite sure all the viewers have also, is what causes diabetes?
The type 1 diabetic problem is linked to a plain and simple destruction of the cell, which are called beta cell of the pancreas, which produce the insulin. So this is more an autoimmune disease. Now, if you ask me what caused this autoimmune disease, there are some genes involvement here and probably environmental factors as well. We don't know exactly what is it, but it's possible that a certain number of genes which have been identified in the future, maybe not so near future, but in the future, there could be some gene therapy to replace the genes which are the defective genes, which makes the fact that the beta cell of the pancreas are destroyed. The second type of diabetes, the type 2 diabetes, is caused most of the time by an insulin resistance, which is linked to the increase in size of the body, basically overweight and obesity, and inactivity, because inactivity let the glucose not enter the cells to do muscular activity, unfortunately. So the main cause is an increase in insulin resistance, or insulin has more and more difficulties to push the glucose into the cell because of the obesity problem. And now, what causes obesity? I think we can come back to that also. Obesity is caused by an excess of food, which people take, and often an excess of sweet food. And probably that will be your next question is about what kind of food we can use to not to prevent diabetes, but at least to minimize the risk of diabetes.
Before talking about food, I would like to know if, the diabetes, is it very serious? We have to focus on, and does it lead other disease? Yeah. Is it? We can find some complication as well for the diabetes.
That's a very important question, Alex. Very important. In some people, I mean, common population, diabetes is considered something serious, but when they see that the treatment is just few tablets to take, they feel that it's not so serious. They probably consider the type 1 more serious because you have injection. But a lot of people with diabetes can still have a long lifespan. Okay. However, when diabetes is severe or start early, there will be a lot of complications because the excess of sugar in the blood is a toxic to all cells. We call it glucose toxicity. It's a fact. So the main two complications are complications on the main big vessels, big arteries, and the very small arteries. We call it macro and microvascular complications. The big vessel complications is the problem which we get on the coronary artery and cerebral artery, which means the arteries will have tendency to reduce their diameter, so the blood flow will not pass so well. And because of this, there will be occurrence of clots in these arteries, which can lead to either heart attack, if this is located into the coronary arteries in the heart, or stroke in the brain when there is a blockage of the clot somewhere in the cerebral artery. So these are serious complications, of course. And many of the people who have heart attack and stroke have often diabetic complications. They are part of the complications of diabetes. The second type of complications are linked to the small vessel disease, which is mainly for the kidney and the eyes. So tendency for diabetic patients in the long term is to have some kind of renal insufficiency, and sometimes it can go to renal failure. So that people will need dialysis to go 2 or 3 times a week to have the cleaning of the blood through a specific machines, which is not something easy for these people. And the second is because of the small vessel in the retina, people will have disorders of the vision, and it can lead to blindness. Blindness induced by diabetes is a very common cause among developed countries of loss of vision. So it's not a disease which doesn't have complications. On the contrary, there are many complications. One more is what we call the diabetic neuropathy, which means the disease of the nerves, and people will have a muscle because the nerves are not working so well. So muscle weakness, they will have insensitivity, they cannot feel properly their skin. And these people will develop, because they don't feel the sensitivity of their feet, they will develop ulcers on the feet, which we call diabetic foot, and that can lead sometimes even to amputation. So again, it's not something minor. And the last one is maybe some old man will be also concerned by that, is erectile dysfunction, because the nerves are affected everywhere, and erectile dysfunction is one of the main causes of diabetes.
Okay, thank you for the details. You were talking about food, so what kind of diet?
I made just a mistake. I just realized. Erectile dysfunction is one of the main complications of diabetes. I said the opposite way. Sorry.
Okay, perfect. So you were talking about food. So what kind of diet or food do we need to have to avoid the diabetes?
I think we can eat almost any type of food except those who are not so healthy in a way. Processed food is known to not be nutritious type of food. Of course, it's simple. You can get it quickly. It's cheap because it's processed, so it doesn't cost so much. But the nutritional values of this food is not great, so it should not be taken as the main type of diet which people should have. Second is all the sweet drinks. I don't mention names here because I don't have any problem, but soda, very sweetened drinks, brings a huge quantity of energy, which cannot be used by especially inactive people or overweight people, and this is stored. And the storage into the liver also, because of the excess of this kind of sweet food, lead also to other complications of the liver. So now, the good type of diet is more on the vegetable side. And I'd like to introduce one notion here, which is the glycemic index. I don't know, do you know what is the glycemic index?
I have no idea.
Okay. The glycemic index is the way of ranking the food in their ability to absorb quickly the sugar into the cell. So some food have a tendency to, in a way, slowly and completely absorb the sugar. I mean, the sugar will come to the blood, but it will be progressive increase into the blood, so there will not be a high increase in sugar.
So they regulate, right? They try to regulate the amount of sugar, right?
Something like this. I mean,
Okay.
this kind of food will not induce a big rise in sugar into the blood, which means there will be no need to have a high quantity of insulin to push this sugar into the cell.
Okay.
So the low glycemic index means this type of food will not rise the glucose, so less requirement of insulin, so good for diabetic people and general population also. There are other types which are medium or high glycemic index. These carbohydrates will induce a high increase in glucose or sugar into the blood, which will require high quantity of insulin, so it can exhaust the production of insulin because of the high rise of glucose into the blood. So the difference here is the low glycemic index, which are the food which are highly recommended, are green vegetable, carrots, beans, for instance. These are good food, carbohydrate with low glycemic index. Medium glycemic index will be bananas and pineapple. which are still good because they bring also fibers, which is also important for the digestion. And the high glycemic index will be the white bread, potatoes, for instance, and rice. So it doesn't mean that they should not take high glycemic index food, because of course it's difficult we still need it. But if especially diabetic people could more focus on low glycemic index food, definitely they will use less insulin, so the control of blood glucose or regulation of blood glucose will be better.
Okay, so you talk about sugar like most of the time. Does sugar cause diabetes? Because sometimes we eat fruits. Fruits contain sugar, so I know it's not a bad sugar, but sugar does cause diabetes?
No, that's a kind of belief, popular belief, that because I eat sugar, I will get diabetes. My grandmother used to say that. No. Sugar does not induce diabetes. Okay, but if there is a high quantity, I mean, the people eat a lot of sweet food, there will be a tendency to increase body weight. And excess of body weight, overweight, and later on obesity lead to insulin resistance, which increase the risk of diabetes. So directly when you take sugar into coffee, it doesn't mean that you are at risk of developing diabetes, but excess of sweet, and especially the fast absorbed sweet, which have this high glycemic index, so like white sugar, like ice cream, candies, these are not ideal food for diabetics. Of course, for normal people, they can take it, but not in excess, always in moderation.
Okay, so we talk about common people, normal people, everyday life, but what about the people who have the diabetes disease? What are the food you maybe recommend they should avoid, they should take, like, yeah?
Normally, what I consider very important for diabetics is to have a specific diabetic education. There are many things, and in the hospital here, you have the endocrinologist, which is the specialist for managing diabetes in terms of medication, looking at occurrence of complication and so on. But the endocrinologist also is referring the patients to a diabetic nurse, we call it like this, or diabetes trained nurse, and also called diabetes educator. And in Thailand, I've been focusing on this for a very long time, and I think since it's a chronic disease, the main doctor is the patient himself, because managing the type of diet and also taking the medicine at the right time, because it has to be together, especially if they get insulin. They cannot take insulin and stop eating. They have to take insulin and eat at the same time. If not, there will be a problem. So diabetic education is very, very important for all diabetic people. And they should know their disease as well as a doctor, in a way. And with this kind of knowledge, they will really prevent a lot of their complications. So there are so many things. I cannot give some tips here, but of course, to avoid the sweet and high glycemic index type of food. Fruits, by the way, is very good because it's low glycemic index. But they should have a proper education. They should follow the curriculum of diabetes education here. And that will help them really in the long term.
Okay, so from my side, I think I ask all the questions. I don't know if you have some tips for people who have like they are quite afraid of this disease. Do you have like do they have to make some test or something like this? Is it very important to make a checkup? We know we are in Thailand. We have like very sugar. They put sugar everything on every plate. So do you have some tips or whatever?
So what you are saying about medical checkup, yes, that's important. But when young people like you don't need to have medical checkup necessarily every year. But once in a while, yes, above 30 years old, you should consider to have medical checkup, a simple medical checkup. It doesn't cost so much here. For that, every 2 years, and starting 40 years old, it should be annual basis.
Okay.
Prevention is always better than trying to treat something which is already in place and so with possible complication. Now, for everyone, there are simple, and that will be the conclusion, the simple rules of healthy lifestyle. Healthy lifestyle is you can eat basically what you want, but there are some food which are not good at all to eat all the time. Okay, if you take sweet food all the time and you eat the quantity of 3 portion or serving of dessert, which should be just one for a normal meal, if you continue like this on a chronic basis, you will have problems. So the core of the healthy lifestyle is number 1, diet. Good diet. Good diet, as told you earlier, lies with more vegetable type of food, looking at low glycemic index. Even though you are not diabetic, you can still, of course, eat potatoes and rice, but the low glycemic index are better for the absorption. In terms of meat, the red meat is not advised for environmental reasons, and it should be also avoided after 40 years old, because we know that red meat has been associated with the cancer of the colon, so that is not really good to take. White meat is preferable, like chicken. Fish is good in general, and eggs are good protein also. Okay, so everything in moderation, and more focus on vegetable for the diet, and more importantly, just the right portion. It's not because it's a nice food that you have to take it 3 portions. Okay, even vegetable, you are not going to take 5 kilograms of carrots. It doesn't work like this. Okay, good food and in moderation. Second point is exercise. This is very important, even for diabetic people, because exercise increases the absorption of sugar to the muscle, which is used for energy. So it's good, and it reduces the level of glucose in the blood. So it fights against the high quantity of glucose in the blood for diabetic people. So exercise is very important, and it's important for the muscle, for the bone. It's important for the mental also. So this is very important. And combined to exercise, you need to be active. It's not exactly the same. To be active is not to stay all the time sitting on your chair. You need to move. You need to do at least minimum 4 to 5 kilometers of walk every day to have a good muscle and also good joints, a good balance. So that's very important. You need to be active, and you need also to do exercise. That you choose whatever you want. You do tennis, I think.
Yes.
Yeah? Okay. You can do swimming. You can do badminton, whatever. But you need also physical exercise as well, on top of being active. The third point is avoid toxic. The 2 main toxic are tobacco smoking, for which there is no reason, there is no medical rationale to smoke. Zero rationale. And alcohol. Alcohol is a bit different because it's part of the culture. It's part of being with friends, enjoying drinks or a beer, as you do sometimes in the evening. But this again, in moderation, because you have to know that alcohol is number 1 enemy for the liver. As soon as alcohol enter into the blood, the liver will stop everything and try to detoxify the alcohol. So please do it in moderation. Okay. And the last, but not the least, is also to have kind of control of your stress. It's especially difficult nowadays with this terrible COVID year. But you still need to find ways to find some relaxation time. Get out of your telephone. Stop looking at all videos on YouTube and get all this bad news from all over the world. Go outside, take a deep breath, see friends, and just try to relax. That's very important, and control the stress like this.
Thank you. So I will take the tips into account for my side. I hope you enjoy all the Facebook Live today. We did it because tomorrow is the World Diabetes Day, 2020. So we all support all the people who have this disease, but also the people who are like afraid of this disease. So we hope that we give you the right information. And we would like to thank you, Dr. Gerard, our medical chief officer,
Welcome.
for this information, tips, and advice. So I wish you a great day and a beautiful weekend to all, and see you soon. Bye-bye.
Bye-bye.